Am I audible to all my participant? Is my video and audio is clear with you all? Just put a comment in the comment section so that we can proceed further. मेरा नाम राज आलमपुर है और हम लाइव आ गए हैं। मैं आप सभी से जानना चाह रहा हूं कि मेरी आवाज़ आपको ठीक से आ रही है क्या? यदि ऐसा है तो आप कमेंट के माध्यम से बताएं कि मेरा ऑडियो और वीडियो बिल्कुल क्लियर है। जितने भी नए साथी हमारे साथ कनेक्ट हुए हैं, सभी का मैं बहुत-बहुत वेलकम करता हूं। आप सभी का मैं इंतज़ार कर रहा हूं कि आपके कुछ कमेंट मुझे देखने को मिलें। यहाँ पे सुमाना हमारे साथ कनेक्ट हैं। गुड इवनिंग है जी। आई एम सुमाना सन्याल फ्रॉम डीएवी डीएवी पब्लिक स्कूल, कलकत्ता। ओके, हेलो। हेलो सुमाना, वेलकम आपका। शाहिदा हमारे साथ रेगुलर व्यूअर हैं, गुड इवनिंग कर रहे हैं। एम आई ऑडिबल टू ऑल माय पार्टिसिपेंट? जस्ट पुट सम कमेंट सो दैट वी कैन प्रोसीड। ओके, ओके, लॉट ऑफ न्यू पर्सन आर देयर। सो सभी का बहुत-बहुत स्वागत है, सभी का बहुत-बहुत वेलकम है। यस, यहाँ पे आ गया है मुझे एक मैसेज कि मैं ऑडिबल हूँ। इतनी देर से मैं बार-बार ऐसे ही बोल रहा हूँ, लेकिन मैं ऑडिबल हूँ, उन्होंने बता दिया है। सो हम शुरू करने वाले हैं। धीरे-धीरे नए साथी कनेक्ट हो रहे हैं। जी, जी, जी। साहिदा जामन आपका वेलकम है। डीआरएक्स विनोद साहा, गुड इवनिंग सर। सुनील जी, डॉक्टर सुनील कुमार जी ऑडिबल हैं। यस, यस, ओके, थैंक यू सुनील जी। विनोद शाह जी, गुड इवनिंग मैम। गुड इवनिंग मैम को भी कर रहे हैं। हेमवती गुड इवनिंग कर रहे हैं और इसी के साथ ये प्रिशीला गुड इवनिंग टू एवरीवन। शेरन गुड इवनिंग टू एवरीवन। अलीशा अलेक्जेंडर गुड इवनिंग है जी। सभी का बहुत-बहुत वेलकम है, सभी का बहुत-बहुत स्वागत है। खुशबू तलवार काउंसलिंग साइकोलॉजिस्ट गुड इवनिंग है जी। सभी का बहुत-बहुत स्वागत है। सबसे पहले तो मैं हमारे आज के प्यारे-प्यारे पार्टिसिपेंट का बहुत-बहुत थैंक यू करता हूँ। आई वुड लाइक टू पे अ ग्रेट ब्यूटीफुल थैंक्स टू ऑल आवर पार्टिसिपेंट एज़ वेल एज़ आवर स्पेशल रिसोर्स पर्सन, स्पेशल गेस्ट, आवर रिसोर्स पर्सन मैम। आपका भी बहुत-बहुत हम पर्सनैलिटी केयर फाउंडेशन की तरफ से वेलकम करते हैं, आपका स्वागत करते हैं। सबसे पहले तो मैं आप सभी को बता दूं कि जो नए साथी आए हैं, किसी भी दूसरे वेबिनार में आज के बाद उन्हें कभी भी रजिस्टर करने की कोई आवश्यकता नहीं है। वो एक बार रजिस्टर हो गए हैं तो जिन्हें व्हाट्सएप ग्रुप में ऐड कर लिया गया है, उन सभी का नेक्स्ट टाइम जो भी वेबिनार होता है तो उसी ग्रुप में वो डिटेल डाल दी जाती है। हमारे किसी भी वेबिनार की कोई भी फीस हम चार्ज नहीं कर रहे हैं। हमने शुरू में सोचा था कि 2-4 वेबिनार ही हम कर पाएँगे, लेकिन आज हम 70 प्लस तक पहुँच गए तो हम कोई फ़ीस नहीं ले रहे हैं, ना कोई सर्टिफ़िकेट का फ़ीस ले रहे हैं। कई लोग कहीं पे एक बार मुझे मैसेज मिला था, दोबारा तो ऐसी शिकायत नहीं आई है कि वो किसी को फ़ीस भेज दिया और उन्होंने उन्हें सर्टिफ़िकेट बना के भेज दिया, बट हम कोई भी चार्ज नहीं करते हैं। थर्ड, जो भी साथी हमारे इस वेबिनार में आते हैं, तो लगभग इसकी चरम सीमा पे यानी जब ये खत्म होने वाला होता है, तो उसी समय हम लोग एक सर्टिफ़िकेट का लिंक आपको डाल देते हैं और आप वहाँ से अप्लाई कर सकते हैं। ये लिंक आपको इस वेबिनार के खत्म होने के बाद भी इसी वीडियो के रूप में ये बन जाता है और इसे हम एक ये कह सकते हैं कि इसके डिस्क्रिप्शन में आपको वो लिंक हमेशा मिलेगा। मेरा नाम राज आलमपुर है, नए साथी हैं उनको मैं अपना इंट्रोडक्शन दूँ, पुराने लोग तो मेरे एक सेम इंट्रोडक्शन को सुन के बिल्कुल बोर हो चुके होंगे। खैर उन्हें आज फिर से सुनना पड़ेगा क्योंकि नए साथी आए हैं। सो मेरा नाम राज आलमपुर है, मैं एक साइकोलॉजिस्ट हूँ, रोहतक सिटी में प्रैक्टिस करता हूँ। रिसेंटली मैं इंडियन आर्मी को मैंने जॉइन किया है, उसके साथ मैं काउंसलिंग और वहाँ के बिहेवियर हेल्थ को देखता हूँ। साथ ही साथ हम लोग पर्सनैलिटी केयर फाउंडेशन एक हमारी संस्था है, उसको हम रन करते हैं जिसका टारगेट है ज़्यादा से ज़्यादा लोगों को मेंटल हेल्थ, लाइफ और इन सब चीज़ों के बारे में अवेयर करवाया जाए। ज़्यादा से ज़्यादा इन लोगों को कि हमारे सोसाइटी में इसको स्टिग्मा लेके चलते हैं, उसके बारे में रिसोर्स पर्सन को, स्पेशल गेस्ट को और एक्सपर्ट को इनवाइट करके आप सभी से लाइव इंटरैक्शन किया जाए। तो बहुत सारे और भी कमेंट आ गए हैं। जी हाँ, जब तक हम हाँ, नताशा गुड इवनिंग कर रहे हैं, हेलो मैम। ज्योतिका, हेलो, बबीता, गुरमीत कौर हमारे रेगुलर व्यूअर हैं। ऐसा कुछ नहीं, आप बोर नहीं करते हैं। अच्छा जी, आपने पहली बार मेरा सेम इंट्रोडक्शन सुना है लगता है। सो यहाँ पे हम लोग पर्सनैलिटी केयर फाउंडेशन से डिफरेंट एक्सपर्ट को इनवाइट करते हैं ताकि वो अपनी एक्सपर्टीज से आपकी नॉलेज को अपग्रेड कर पाएँ, सोसाइटी में स्टिग्मा है जो उसको कम कर पाएँ और हम पार्टिसिपेंट से भी अब थोड़ी-थोड़ी उम्मीद करने लग गए हैं कि यदि उन्हें काम की चीज़ें लगती हैं, तो वो लोग अपने नियर डियर को शेयर करके भी बता सकते हैं कि ऐसा भी कुछ सोसाइटी में हो रहा है। अकेला चना भाड़ नहीं फोड़ सकता, अकेला आदमी कुछ भी नहीं कर सकता। तो इसीलिए सभी लोग मिलके थोड़ा-थोड़ा भी करेंगे कि ठीक है जी, आपको अच्छा लगे तो आप अपने 5, 7, 10 ग्रुप में भेज दें इसको और बताएँ कि हाँ, ऐसा-ऐसा कुछ हो रहा है। तो ताकि लोग थोड़ा-सा गड्ढे में गिरने से पहले सीखें कि ये गड्ढा था। तो बाद में जानबूझ के गिरना है वो तो एक अलग बात है, लेकिन हमारा काम है कि हम कम से कम उन्हें बताएँ कि इन सब चीज़ों पे काम हो रहा है। इंडिया में 2024 में हम जी रहे हैं और कहीं दलदल में, कहीं बेवकूफ़ लोगों के चक्करों में फँसने की आवश्यकता नहीं। मेंटल हेल्थ भी उतना ही ज़रूरी है जितना कि फिज़िकल हेल्थ है, बल्कि उससे कई बार ज़्यादा ज़रूरी है। क्योंकि फिज़िकल हेल्थ हमें दिख जाता है कि पैर में चोट है, लेकिन मेंटल हेल्थ कई बार दिखता भी नहीं है और लोग नई-नई बातें बनाते रहते हैं। सो राखी हमारे साथ कनेक्ट हैं। हेलो राखी, सुमन कुमारी जी आपका भी वेलकम है। सो मैं धीरे-धीरे बहुत सारे नए साथी जुड़ गए हैं। आप जानते हैं कि इन सारे काम को करने में एक लंबी प्रोसेस लगती है। और उसमें एक लंबी मेहनत लगती है। सो आप सभी को मैं कहूँगा कि आप थोड़ा हमें सपोर्ट कर सकते हैं और इसके लिए आपको कोई जीएसटी नहीं देना है, बस हमारे चैनल को सब्सक्राइब करना है और साथ-साथ यदि आपको हमारे रिसोर्स पर्सन या मेरी थोड़ी बहुत बातचीत एक आधी लाइन अच्छी लगती है, तो आप हमारी वीडियो का लाइक करके हौसला बढ़ा सकते हैं। तो ये सब मुझे बताना होता है, आज मैं आपका होस्ट हूँ। आइए आज हम सभी लोग हमारे रिसोर्स पर्सन का वेलकम करेंगे। सबसे पहले तो मैं वेलकम करता हूँ स्पेशली हमारे बीच में आज के हमारे जो रिसोर्स पर्सन हैं दिव्या साबू मैम, आपका बहुत स्वागत करते हैं। पर्सनैलिटी केयर फाउंडेशन की पूरी टीम आपका बहुत-बहुत स्वागत करती है। जब तक मैं मैम के बारे में बताऊँ, आप सभी पार्टिसिपेंट भी एक प्यारा-सा शब्द स्वागत का, वेलकम का कमेंट में लिख सकते हैं, अपनी लैंग्वेज में लिख सकते हैं। बस ताकि उनको भी मतलब इस टाइप की लैंग्वेज में लिखें कि हमें समझ में आए। कहीं तो आप ऐसी भाषा लिख देंगे तो स्पेनिश मुझे आती नहीं है, बल्कि मुझे 2-3 भाषाओं के अलावा कुछ आता ही नहीं है, यही भाषाएँ आती हैं। तो आप एक प्यारा-सा वेलकम शब्द लिखें और तब तक मैं मैम के बारे में आपको बताना चाहूँगा। सबसे अच्छी बात तो ये है कि जो निव्या मैम हमारे साथ कनेक्ट हुए हैं, ये पहली बार नहीं दूसरी बार कनेक्ट हुए हैं, तो इनका डबल वेलकम बनता है। दूसरा इसी के साथ में जो भी साथी निव्या मैम का पहले वाला सेशन देखा है तो वो बहुत ही ज़्यादा शानदार रहा था, मुझे अभी तक ध्यान है। तो आज दूसरे टॉपिक पे बात करने वाले हैं। आज के हमारे रिसोर्स पर्सन निव्या मैम, उन्होंने एमएससी किया है साइकोलॉजी में और साइकोलॉजी में आप जानते हैं क्लिनिकल जो स्पेशलाइज़ेशन है उनमें किया है। साथ के साथ मैडम यूजीसी नेट जो है वो भी क्वालिफाइड हैं और रिसेंटली केरला में एक कॉलेज के अंदर एक जगह इंस्टीट्यूट के अंदर वो एज ए असिस्टेंट प्रोफेसर काम कर रही हैं और ये हमारे लिए बड़े ही सौभाग्य की बात है कि असिस्टेंट प्रोफेसर आज एक ऐसे टॉपिक पे बात करेंगे जो साइकोलॉजी से जुड़े हुए लोग हैं वो तो इस शब्द से बिल्कुल परिचित ही होंगे। तो मैं मैम का बहुत-बहुत स्वागत करता हूँ और आइए हम बात करें स्किज़ोफ्रेनिया पे जो एक बहुत बड़ा मेंटल डिसऑर्डर और न जाने इसके बारे में क्या-क्या मिथ हैं, क्या-क्या इसका क्राइटेरिया है डीएसएम में इसके बारे में आज जानेंगे। आइए हम सभी लोग मिलके वेलकम करें। मैडम आपका बहुत-बहुत वेलकम है। प्लीज़ ओवर टू यू।
Thank you for the warm welcome. Thank you so much. And it is my pleasure to give a session for Personality Care Foundation. So, the topic that I want to discuss today is schizophrenia. So, we all know that schizophrenia is a mental health disorder, and it is a particular disorder that is mostly shown in movies, and it is a very dramatic kind of disorder that all of the people think when we refer to mental health disorder. Most of the images or most of the pictures that people have in front of them is regarding schizophrenia. As we know, it is a very bizarre disorder. First, let us talk about the history of schizophrenia.
The term evolved Greek physicians described about various symptoms of schizophrenia, like delusions of
Paranoia, deterioration in cognitive functions, and personality. We will be getting more into all these symptoms in the later on phases of the session. Yes, and but only in 19th century, schizophrenia emerged as a medical condition that is worthy of study and treatment. Until 19th century, it was not identified as a disorder that require special treatment, and it was not a separate disorder from various other disorder that was considered by the medical physicians. The two major figures in neurology and psychiatry who discussed and studied about these disorders were Emil Kraepelin and Eugene Blower. So Emil Kraepelin translated a particular term called demens precoce by Benedict Morel into dementia precox. Benedict Morel used the term demens precoce to refer to the patients with deteriorating cognition and having early onset of disorder. Dementia refers to the deterioration in cognition, that is, the deterioration, that is, the reduction of the ability to think properly, to reason properly, to judge things properly. And early onset means the disorder started in the beginning phases of life of an individual. And later on, Emil Kraepelin used another term called manic depressive psychosis. So, this particular term was used for the patients who had distinct episodes of illness and having alternative periods of normal functioning. So, he used the term dementia precox for the cognitive deterioration as well as for hallucinations and delusions. But he used another term, manic depressive psychosis, when the patients had a period of normal phase between these abnormal symptoms. He also used another term called paranoia. He used this term for the people who had He used this term for the people who had various persecutory delusion, feelings that others are going to harm them, feelings that they are going to be attacked. So these are the three terms used by Emil Kraepelin. Now let us get into Eugene Blower. So Eugene Blower is a person who coined the term schizophrenia, and it replaced the term dementia precox from the literature. Till then, this particular term, known as dementia precox, was used for individuals who suffered from the symptoms of schizophrenia. And schizophrenia is a Greek term. Schizo means split, and phrenia means mind. It is a split in mind. It was used to express the presence of the schisms or the split in the thought, emotions, and behaviors of the patients with this disorder. And Bloor also stressed that, unlike Kraplin's concept of dementia precox, schizophrenia need not have a deteriorating course. So, schizophrenia could be a stable course as well. The symptoms need not deteriorate in case of schizophrenia, according to Bloor. But that is not what Emil Kraepelin said. Some people use the term split personality for schizophrenia as the meaning of schizo is split. But actually, split personality refers to dissociative identity disorder or multiple personality disorder, which is completely a different scenario, which is completely a different mental health disorder. And he also identified four rays of schizophrenia, four symptoms, primary or fundamental symptoms of schizophrenia, which began with the letter A. The first one is association. Association refers to the dissociation in the disturbances in the associations of thought or the dissociation of thought. Then affect, the disturbances in the way in a person expresses one's affect or emotion or feeling. Autism. He referred this particular term to the disorganized thinking pattern or the fantasy type of thinking or non-goal directed thinking. And he also considered a symptom known as ambivalence. So, according to Bloor, ambivalence refers to the presence of both negative and positive symptoms at the same time. This is what Bloor told about ambivalence, not just the primary symptoms. He also brought forward few secondary symptoms, and the secondary symptoms were hallucinations and delusions. These were the symptoms, according to Emil Kraepelin, the major indicators of dementia precox, or the term that was used for schizophrenia initially. We will get to know more about hallucination and delusions and various symptoms in the later phases of the session. So, the age of onset of schizophrenia is typically in the late teen years to early 30s, and it is mostly seen in males than in females. So, according to various international prevalence rates, the schizophrenia among non-institutionalized person is 0.33 percentage to 0.75 percentage. That is, in 1,000 people, we can find 3 to 8 or 3 to 7 people with schizophrenia in 1,000 human beings. Schizophrenia is one of the top 15 leading causes of worldwide disability, and it also causes premature mortality in individuals. And the premature mortality is caused by the co-occurring physical conditions as well, like liver disease, diabetes, heart disease, and so on. The rate of suicide in patients with schizophrenia is about 5%. Now let us look into the DSM-5 criteria of schizophrenia. So DSM refers to the Diagnostic and Statistical Manual for Mental Disorder, and it was brought forward by the American Psychiatric Association. So there are various criteria under DSM-5. So I'll be explaining it in a brief way. So the first criteria, criterion A. So in criterion A, we have 5 symptoms. So of these 5 symptoms, there should be at least 3 symptoms to diagnose schizophrenia. And it should be present for a period of 1 month. And these are also known as active phase symptoms. Now let us look into the first symptom. The first symptom is delusion. Delusion refers to the fixed false belief an individual have that is culturally inappropriate. And the person will not change this particular belief that he or she has, even when the person is presented with contradictory evidences. The person is very stubborn about the delusion that a person has. So, for example, I had a discussion during my clinical internships about a patient, and she had a particular delusion, and this was her delusion that she was the daughter of Rajiv Gandhi, even though she was presented with various contradictory evidences. She never believed that she was not. She believed that. So that is a delusion. The delusions are of various kinds. We can look into it. The next one, hallucination. The second symptom is hallucination. So hallucinations is a false sensory perception. It is that the stimulus, the real stimulus is not present. It is non-existent, but we feel it, but we sense it. We perceive something is around, such as a sight. We are seeing something that is not existing. We are listening to something that is not existing, and that is hallucinations. And hallucination is different from illusions. For illusion, there is a stimuli, but we are misinterpreting the stimuli. But in case of hallucination, there is no stimuli at all. The third symptom is disorganized speech. The person would be having various deficits in speech, and it would be disorganized, like there wouldn't be association between what the person is saying. The person would be bringing about random things in speech. It wouldn't make any sense to anybody else. And the fourth symptom is grossly disorganized or catatonic behavior. The behavior would be very disorganized, it could be inappropriate, it could be very weird. And catatonic behavior means there would be uh, lack of reduced movement. The movement, there would be a lack in the movements that a normal person would do. Then finally, the fifth symptom is negative symptoms. So negative symptoms are the symptoms that is present in normal individuals, but it is absent in the patient affected with schizophrenia. So individuals with schizophrenia lack this particular trait that normal individuals have. The first one is alogia. I would like to talk about various negative symptoms. The first one I would like to discuss is about alogia. Alogia refers to the deficit in speech. The person would have reduced speech. The productivity of the speech would be reduced. Then flattened effect. The person would be having difficulty expressing the emotions. It could be also known as blunted effect. Difficulty in expressing emotion through words or through facial expressions and so on. Then avolition. Avolition is a reduced goal directed activity due to the decreased motivation. The person would seem very lazy. The person would be doing nothing in case of avolition. The next, anhedonia. Anhedonia refers to the lack of feeling pleasure, the lack of experiencing pleasure, the reduced ability to feel pleasure. Then asociality. It is a loss of interest in social interaction and attentional deficits. They would not be having the normal attentional capacity, the attentional ability that normal individuals have. So these are the negative symptoms. We also have positive symptoms, but we already discussed them. Delusions and hallucinations are the positive symptoms of schizophrenia because normal individuals do not have these symptoms, and individual it is added in the symptoms of individual with the individuals with schizophrenia. It is something added. Okay. So next let's move on to the criterion B. So for a significant portion of time since the onset of the disturbance of the individual, the level of functioning in one or more major areas of functioning, like interpersonal functioning or occupational functioning, educational functioning, it should be markedly below the level that is achieved before the onset. Basically, the person's functioning level in various functioning aspects, like as I discussed, would be very less. And the third one, the criterion C, is that there would be continuous signs of disturbances. There should be continuous signs of disturbances for at least 6 months. It means that at least for 1 month, the person should have active phase symptoms that we already discussed in the criterion A. But the person, in total, the person should have disturbances for a period of 6 months for diagnosis. These symptoms can be called as prodromal or residual symptoms. Prodromal symptoms refers to the symptoms that occurs before the active phase symptoms. And residual is after a phase of active, after the phase of the criterion A symptoms, there comes the residual symptoms. So it is characterized by only negative symptoms or the presence of criterion A symptoms in an attenuated form, in a reduced form, in a less intense form. So at least 6 month period disturbances should occur in the person with 1 month of active phase or active criterion A symptoms. And next is the criterion D. So the individual with schizophrenia should be ruled out from the chances of having schizoaffective disorder or depressive or bipolar disorder with psychotic features. So in both schizoaffective and bipolar disorder or depressive disorder with psychotic features, we can see symptoms of schizophrenia. So we should rule out the chances of these both disorders. No major depressive or manic episode should occur concurrently with active criterion A phase symptoms. It should not occur together. Or if mood episodes are occurring, then it should be only for a very minor duration of time with respect to the active symptoms. And the next criteria, the disturbance should not be attributed to the physiological effects of substance use or any other medical condition. So the disturbance in schizophrenia should not be caused by the usage of any drugs or any medical condition. And criterion F. If the person has a history of autism spectrum disorder or communication disorder of childhood onset, then schizophrenia will be only diagnosed if the person has prominent delusions or hallucinations. This is because in autism and communication disorder, we can see negative symptoms as well as disorganized behaviors. So we should not confuse it with schizophrenia. Now let us move on to the clinical features of schizophrenia. So the first one I want to discuss is the disturbances in thoughts. So disturbances in thoughts can be divided into three: the disorders of thought content, the disorders of thought form, and the disorders of the stream process of thought. So in the disorders of thought content, it reflects the patient's ideas, beliefs, and interpretations of a stimuli. So this is majorly the delusions that a person has. So the delusions, we already discussed what delusions are: fixed, false beliefs, stubborn beliefs. And there are various kinds of delusions. Persecutory delusions, where a person thinks that person is being stalked, hunted, framed, or tricked. The person is going to be harmed or killed. Referential delusions. The person thinks that public form of communication like song lyrics or a gesture from a TV host has a special meaning towards them or has a special message towards them. Somatic delusion. It is concerned with the soma or our body. The person thinks the person has a terrible illness or a bizarre problem like worm under skin or the damage from cosmic rays. Something is wrong with their body and they have delusion regarding that. Then erotomanic delusions. The person would think that a person of higher position or a famous person is in love with them. They falsely believe that. That is erotomanic delusions or delusions of love. The next one is religious delusions. Someone might think that they have a falsely think they have a special relationship with God or they are God or they are saint. That is religious delusion. Then grandiose delusion. They think that they are a major figure on the world stage. They have special powers, they have special skills in terms of other people. That is grandiose delusions. Nihilistic delusions. It is the denial of existence of various aspects, one's body or self. A person would think that the body is amputated or the body is non-existent. A person would believe that the person is non-existent. That is nihilistic delusion. Now let us move on to the disorders of form of thought. So form of thought are something that is objectively observable in the spoken or written language of individuals. The form, how they express, or what comes out through their words or through what they write. So let us discuss some kind of form of thought disorders. Loosening of association. We already discussed because it was in the forays of Eugene Dover. A person would be jumping onto different concepts without having a major association between those thoughts. Then incoherence. In incoherence, they do jump between various thought processes, various thought contents, but there is a lack of logical flow in incoherence. They are not logically connected. They just jump without any logical aspects involving in it. Tangentiality. The person would be starting from one point of discussion and without staying on the topic, they would be moving on to the next, to the next, to the next, to the next. It would be in connection, but the topic would change gradually. Circumstantiality. In circumstantiality is same as tangentiality. The topic would change gradually, but afterwards they come back to the old topic. That is circumstantiality. The neologisms. In neologisms, neo means new. They would be making up words, making up new words, and it wouldn't have any particular meaning. They are just created at the spot. Echolalia. Echolalia is referred to as parrot like speech. What is parrot like speech? When we speak something to them, they'll be giving us that back. The parrot will be talking that back. So that is parrot like speech or echolalia, the meaningless repetition of words just spoken by another person. Then verbigeration. It is the compulsive repetition of meaningless words or phrases. They'll be saying the same thing again and again. For example, the sun rose, the sun is rising, the sun is rising. They'll be saying that again and again and again. They needn't be meaningful. It would be just meaningless. Then word salad. It is a confused mixture of random words or phrases. They'll be bringing out a lot of words together and they are trying to make it into a sentence, but it is completely unintelligible or a confused sentence. And finally, mutism, the lack of speech at all. The next thought disorder is a disorder of thought, process of thought. It concerns the way ideas and languages are formulated, how they are formulated in our minds, how the ideas come up in our minds. Flight of ideas, where the person brings a lot of new ideas, and new ideas are getting created in the person's mind in a very rapid way. Thought blocking. When a person is talking about a particular thing, suddenly the person gets stuck. The thought is blocked. That is thought blocking. We can see these symptoms like flight of ideas and thought blocking in anxiety disorders as well, OCD and anxiety disorders as well. Impaired attention, the poverty in thought content, poor abstraction abilities. Perseveration. Perseveration means if a person starts to talk about a particular topic, the person resists to move on to another. The person would be talking about the same again and again. So these are some of the symptoms that I wanted to discuss with you. Then there are various symptoms as well, like thought control. Thought control refers to a person thinks that the person's thought is controlled by an external agent. The person is not the one who is thinking, but an external agent is controlling one's thought. Thought broadcasting. Thought, thought broadcasting means one's thought is being broadcasted and everybody knows what one person is thinking. It is known to everyone. The mind is known to everyone. Some people think that a chip is placed on their body by somebody else and their thought could be understood by everybody. That is a common symptom that could be found in individuals with schizophrenia. Now let us move on to the disturbances in perception. So we discussed about the disturbances in thought, next the disturbances in perception. So the disturbances in perception is hallucination. We already discussed what hallucination is, the false perception of a stimuli, and it can occur in any sense. When I am seeing something that is not existing, then it is visual hallucination. When I am hearing something that is non existing, then it is auditory hallucination. When I am smelling something that is not existing, there is not a smell like that, then it is olfactory hallucination. Some people with schizophrenia feels like the smell of blood. Always they have the sensation of the smell of blood or smell of dirt. This is something that is seen in patients, but it is not very prominent. Auditory hallucination and visual hallucination are the prominent forms. Then tactile hallucination, the feeling that they are being touched. When I was interacting with a patient, he told me that he feels like somebody is holding him and somebody carries him to another place. And he feels that. He feels like being carried. Then gustatory hallucination, tasting something, tasting something, tasting a stimulus that is actually not existing. That is gustatory hallucination. Now let us move on to the disturbances in motor behavior. So the disturbances in motor behavior are of various types. First one is stupor. Motor behavior means the abnormality in the movements, the actions, the overt behavior, the overt action. Stupor means the marked decrease in the reactivity to environment. I'm not responding to the environment even when a stimulus is present. My body is not reacting to it. That is stupor or mutism. Then excitement. Excitement does not refer to normal excitement that individuals have. In schizophrenia, we refer this term to the purposeless motor activity that is abnormal in nature and it is not influenced by an external stimuli. Then the third one is posturing. The voluntary assumption and maintenance of inappropriate or bizarre posture. The person would be standing like this or something like that, and they'll be maintaining that posture. That is known as posturing. Then negativism. It is the motiveless resistance to all the attempt, all the instructions to be moved. For example, I'm telling a person with negativism, please raise your hand. The person would not be doing that, would resist my verbal instruction to do something, to do an action or a movement in opposite direction. Then rigidity. In case of rigidity, the patient maintain a particular posture. For example, a patient is holding hand like this. I'm holding my hand like this because then you can see it. A patient is holding hand like this. Then the therapist is coming and trying to pull this down and the patient is not resisting every attempt of the therapist to bring his hand down. This is known as rigidity. Negativism is through instruction. Well, rigidity, the person is actually, another person is trying to bring down with physical exertion. Then waxy flexibility. In case of waxy flexibility, the therapist comes and moves the hand of the patient or moves the limb of a patient in a particular posture. Suppose this is the hand of the therapist and this is the hand of a schizophrenic patient, and the therapist moves like this and keep like this, and the patient wouldn't move. The hand would be like this for hours and hours. This is waxy flexibility. Then command automatism, automatic compliance with instructions. Hands up, hands down, go to left, go to right. Whatever instruction that I'm giving, the person is complying without even thinking about it, without even thinking what kind of instruction is it or what kind of intent is behind this instruction. Automatic, complete compliance. That is command automated. The fourth one is the disturbances in affect. The disturbances in affect is the abnormality in the way we experience and express emotions. In case of blunted affect, we already discussed about blunted affect or flat affect. There is a decreased ability to express emotion through facial expressions, tone of voice, or physical movement. In case of apathy, there is a lack of emotional experience. In blunted affect, the person is not able to express the emotions. In case of apathy, the person is not experience emotions at all. And there is something known as incongruity of affect. The person might be saying a very sad story from the person's life, and the person would be laughing like anything. There would be incongruity of effect, or vice versa. The effect would be very different from what is currently happening. The next one is the disturbances in cognition. So, in case of the disturbances in cognition, there is an impairment of selective attention. The person is not able to focus on a particular thing that requires attention in this person's life. Then there is a lack of ability to sustain, to persist one's attention and concentration. And there is also disturbances in the executive functioning. Executive functioning refers to the thinking and judging, problem solving, reasoning capacities of a person. There is a huge alteration. So these are the clinical features of schizophrenia. Now let us move on to the etiology. The first one is genetic factors. There is an increased rate of schizophrenia among the biological relatives. That is, if a person is having schizophrenia, then there is higher chance the person's relative will also have schizophrenia. And it is also higher in the monozygotic twins than dizygotic twins. So in case of monozygotic twins, if one of the twin is having schizophrenia, then there is 50% chance that other twin will also be affected by schizophrenia. But it is lesser in case of dizygotic twins or fraternal twins. Monozygotic twins are identical twins. They share the same DNA, while dizygotic or fraternal twins do not share the same DNA. And the age of the factor can also influence the development of schizophrenia, according to some studies. It is because of the spermatogenesis, the origin or the development of sperms and of sperm health. The next one is the biochemical factors. There is something known as dopamine hypothesis. So, according to that, schizophrenia can result from high dopamine activity. Serotonin, which is a neurotransmitter, can cause both positive and negative symptoms of schizophrenia. The abnormality in the secretion of serotonin, not serotonin, the abnormality in secretion. The abnormality in norepinephrine, the dysregulated secretion of norepinephrine can cause anhedonia, the decreased ability to feel pleasure. Then GABA, gamma aminobutyric acid. So it is a particular neurotransmitter that regulates the dopamine activity. So when GABA is disturbed, automatically the dopamine activity would also be disturbed, thus being a cause of schizophrenia. It needn't cause schizophrenia, but it could be a factor. Then the changes in the secretion of neuropeptides, glutamates, the neurotransmitters like acetylcholine and nicotine will also affect this particular disorder. Now let us look into some physiological. We looked into genetic factors, biochemical factors. Now let us look into some physiological aspects. The enlargement of cerebral ventricles is a causal factor. is an etiological factor of schizophrenia. So cerebral ventricles are interconnected series of cavities which is filled with cerebrospinal fluid. And when it is enlarged, it can cause various symptoms in individuals as well as the symptoms of schizophrenia. And we know that our left and right brain lobes are quite symmetrical. But when the symmetry is reduced, when they have a huge asymmetry, then it can be a cause of schizophrenia as well. Then the limbic system, when there is a decrease in the size of limbic system, amygdala as well as hippocampus, it could act as a causal factor of schizophrenia. And we know prefrontal cortex. This is prefrontal cortex, prefrontal cortex. And the anatomical abnormalities in the structure of this particular brain area could be a causal factor. Then thalamus, the shrinkage in the volume or the neuronal loss of thalamus could be a new factor. Then basal ganglia and cerebellum. These are two areas of the brain, two regions of the brain. When there is a difference, when there is an abnormality in these areas, it can cause movement disorders, awkward positioning, facial grimacing, weird posturing. All these could happen when there is a change in the anatomical structure of basal ganglia and cerebellum. Now let us look into how family dynamics could affect this particular disorder. A poor mother and child relationship could be a factor. So the attachment styles that a child develops is very important. The disorganized attachment styles could be a factor that could cause schizophrenia. When a person's mother is schizophrenic, then there is a high chance that a child also develops such disorder. Then pathological family behavior can also lead to emotional stress. Pathological family behavior means, suppose the children are receiving conflicting parental messages about the behavior, attitudes, feelings, etc. The father is telling the child something and the mother is telling the child opposing things, then the child would be in a confused state. They would withdraw into a psychotic state to escape the unresolved conflicts within them. This is known as double bind, and it was formulated by Gregory Bateson and Donald Jackson. The next one is something known as schisms and skewed families. Schisms occur when one parent is closer to the child and the other parent is not. And skewed families refers to when the parents are involved in power struggles. There is a skewness, there is a distortion in the family. And it was brought forward by Theodore Litz. Schisms and skewed families. Then expressed emotion. The emotions that are expressed by the family members to an individual, to the patient. The expressed emotion could be criticism, hostility, over involvement into the patient's life. So this could negatively affect the patient's symptoms. So these are some of the etiological factors or causal factors that I wanted to discuss with you all. Now let us move on to some of the treatment aspects of schizophrenia, and this is the last topic that we are discussing today. The first one is pharmacotherapy or medicines or the medical therapy. So some of the medicines that are used for schizophrenia are chlorpromazine and clozapine. So these could be also known as antipsychotic medications. The next one is hospitalization. The individuals with schizophrenia are hospitalized for diagnostic purposes, for the stabilization of medications. If the patients are sent home, they might not take medications properly. It should be checked, it should be recorded properly. So they will be hospitalized for those purposes. And it is also for the person's safety because we know that there is a 5% of chance of suicide among patients with schizophrenia. Any suicidal or homicidal ideation should be prevented. And also, there is a high chance that they might engage in disorganized or inappropriate behavior, even illegal behavior. So, those behaviors should be prevented as well. And some people might have inability to take care of themselves, to take care of their basic needs such as food, clothing, and shelter. So, these would be provided. Then, family oriented therapies. Family oriented therapies should be given to them to make the families understand about what is happening in the patient's life. What are the symptoms? What are the medications given to the patient? And what would be the effects of the medication, the side effects of the medication? What would be the recovering phases of the patient? How long would it take for the patient to recover? Or whether it would ever recover? So the family members need to be psycho-educated about all these aspects. Not just that. The family members would be also going through various stressors in their life because of the individuals with schizophrenia in their family. So they should be able to cope their stress and regulate their emotions. And they should be also given information regarding the gradual reintegration of the individual with schizophrenia into the family as well as to the society. Now let us move on to some biological therapies. The first one is electroconvulsive therapy or ECT. This is something we might have seen in movies. The patient would be a thing like this would be kept on the patient's head and on the mouth, and electric signals would be given. We would have seen this in movies, and it is extremely terrifying. That is ECT. So it is something. It is sending the electric signals to brain to stimulate various brain areas, and it has various and ethical aspects behind it as well. And there are various other behavioral therapies as well. One is social skills training. So the patient would be lacking various social skills. They have poor eye contact, they would have poor eye contact, unusual delay in the response to another individual, odd facial expressions, lack of spontaneity in social situations. They wouldn't spontaneously react to situations, inaccurate perception of others' facial expression, or lack of perception. They wouldn't, if a person is sad, they might not be able to understand the person is sad. Or if another person is smiling at them, they might not be understanding, okay, this person is happy to see me. They might not be able to process that. So, social skills training is directed towards all these aspects. The next one is dialectical behavior therapy. So, this is a particular therapy. This was formulated for individuals with borderline personality disorder, but it is also used for schizophrenia patients if they have major emotional abnormalities as well as interpersonal problems. It helps to improve interpersonal skills as well. Then vocational therapy. So vocational therapy is to help individuals gain or regain the old skills and gain new skills. And this particular therapy is to make the person active and to make the person involved in any job. The person should be able to be financially independent. So this particular therapy focuses on that. These include sheltered workshops, job clubs, part-time or transitional employment, program. And one more therapy that I want to discuss with you is cognitive behavioral therapy. So this therapy is used in schizophrenic patients to improve their cognitive distortions in the thought processes that they have, the way of thinking, but it could be only provided to schizophrenic patients if they are not showing major positive symptoms like hallucinations. If they are having hallucinations or very prominent hallucinations and disorganized behavior, inappropriate behavior, first attention would be given to that and not to their thought processes. But if those symptoms are reduced, then we would move on to their thoughts, to transform their thought, to change their thought. That would eventually lead to the change in behavior. That's what CBT focuses on. And to reduce their distractibility, the impairment in attention, as well as the errors in their judgment. So these are the things that I wanted to discuss with you today. Yes. So this is it. You can ask if
So,
any doubts are there.
so first of all, I want to express my heartful thanks for this enlightenment webinar on schizophrenia you conducted. And I think your expertise of this topic is really incredible, valuable for all participants as well as me. I think your latest research and your treatment strategy like CBT and biological therapies, your practical advice you provide were particularly beneficial for us. And I think your clarity of this topic, basically you broke down some complex thing in very simple thing, and this concept made the session very engaging for all participants. I hope all participants also enjoy as well, as it is totally very educational. Every single sentence is totally connected to insight related to schizophrenia. So thank you once again for your time, your effort, and basically for making this webinar successful. So I want to pay beautiful thanks to our resource person. Even lot of participants are also typing that very well explained. Mahesh Kumarji, nice session. Hina, a lot of comment are there. We would like to read, but now it's time to some question. If you have any query related to schizophrenia, you can just put a comment and we will discuss on it. So let's wait for comment. Till that, I am reading these basic comment that Mahesh Kumarji is saying very nice session. Sahibaji very well explained. Hina great learning experience, Mehmet sir. Psycho solution. Uh, Babita and Pallavi they are also saying very beautiful and excellent. B Gomes and Dipavinta Roy. Thought were complicated, but I get an idea about it. Thanks a lot. Okay. Pallavi, thank you. You too, Raj sir. Okay. Thank you so much. Anshika Gupta, so insightful sessions. Sejal carry great session, ma'am. Babita Dubey, thank you, ma'am. Ria Nathal, excellent session. The explanation was very clear, and thank you, ma'am and sir. Okay. Himavati Raja Ram. Thank you once again. Full session amazing. Okay. Raki is a regular viewer. Thank you for this enriching session. इसके बाद after that, good evening, ma'am. This is Sivani from your class. Okay. And under the disturbance in motor behavior therapy, what are the difference between posturing and rigidity? So once there is a student of our resource person Sivani. Sivani, just want to know, ma'am, have you read the comment?
Yes, I read the comment. I'm so happy to
Okay.
have my students here. So much.
Okay.
Thank you so much for being here, dear students. And so, the difference between posturing and rigidity. Posturing means that a person is voluntarily assuming and maintaining an inappropriate posture. Let it be this. Okay. It is just having a particular posture like this, and the person is maintaining it. Suppose another person is coming and trying to move this, but the person is resisting, then it becomes rigidity. Did you understand? So this is
Yeah, yeah.
posturing means the person is having a particular posture, and when another person is trying to move that particular posture and the person is resisting, then it is rigidity.
Right, right. Great. Uh, Maureen, one more question is there. Ma'am, can an individual be completely cured of schizophrenia?
That is something that I'm unsure about. Regarding in my clinical experience, I haven't seen patients like that. I do have seen individuals going through normal periods or residual periods, but they are still under treatment. They are still having their medications, and that is where that I have seen. It is very difficult to completely eradicate the symptoms of schizophrenia. Even if the primary active phase symptoms are eradicated or alienated, or but still there would be some emotional disturbances or cognitive disturbances might be there.
Great. And in my practice, the same concept like ma'am is saying, but some of person have completely cured. I think they are at initial stage or whatever it is. But lot
Oh,
of psychologists think, yes.
that is a
Uh,
great news. And in initial phases, it would be very much easier to have them treated.
right. Ansika Gupta, ma'am, uh, is there any chance of an old age adult having dementia could lead to schizophrenia?
I am unsure about that. I will definitely look into it. Dementia means there would be definitely various changes in their brain. This is various changes in their brains. Their brain cells will be deteriorated. So there is a chance that they might develop symptoms like hallucinations or delusions. And delusion something is seen in individuals with dementia, but we would never call it as schizophrenia. It is a part of dementia, the occurrences of delusion. Schizophrenia might also occur because their brain is getting damaged. But I'm not sure if they would be giving an additional diagnosis of schizophrenia. I'll definitely be looking into it.
Okay, okay, sure, sure. रजनी मैम वेरी इंफॉर्मेटिव सेशन OGR मलिक पूछ रहे हैं सर्टिफिकेट सर्टिफिकेट विल बी पब्लिश्ड इन द सेम webinar description. So Juneja is there, मैम ECG या शॉक ट्रीटमेंट कब दी जाती है? क्या इसका वहम भी हो सकता है हमें कि हमें कहीं बेहोशी में ट्रीटमेंट दी हो? I mean to say that what is the exact time for biological therapy like ECG?
I think ECG is a ECT. It is ECT. Uh,
ECT.
oh, I read
Okay, ECT.
ECG.
ECT, but
Oh,
our
ECT.
participant.
Okay, that's okay. ECG is actually electrocardiogram. It is a recording of the signals in heart, and it is ECT, electroconvulsive therapy. So it is when the symptoms are very devastating or very deteriorating for the patient, and the patient is showcasing extreme inappropriate behaviors and very increased symptoms. So that is when ECT is given, but it is not um, something that is promoted because it has its own side effects.
Yes, but all psychiatrists, I think, practice it a lot
Because
according to their.
in for my in my practice, I have only heard about like one ECT in my entire clinical practice. I've only heard about a single person. I only seen in a single person.
Yes, a lot of researches are there that they belongs to ECT and it has some side effect also. But sometimes there is no option. That's why
That is why
practice
they give
practitioner.
ECT.
Hina is saying very good explanation. Dr. Vinod Saha, DRX Vinod Saha, grateful grateful session. Okay. Dr. Sunil Kumar, there is no problem of posture and rigidity. Okay. Ahmed ji, thank you so much. Dr. Sunil, great informative. Thank you, Doctor. IUC, very informative. Now, Rose Naveen. Hi, Nivya. Uh, I'm your junior at RCSS Kochi. It was enlightenment session. So, hello.
Hi,
I
Rose.
think,
Hi, Rose. Chechi means it means sister in our Malayalam, in our
okay,
language. It
okay.
means elder sister.
Elder sister Chichi.
Chechi.
Chechi. Okay.
Yeah.
That
For
it is
behan
very
kind of words.
like elder sister. In Haryana, it is called Didi or Gigi.
Jizio.
Okay, Natasha, very informative session. Dr. Sumil Kumar, thanks a lot. Priscilla, very informative session. औजियार मलिक सर्टिफिकेट 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 औजियार जी आपका ये नाम देके हम खुद ही सर्टिफिकेट आपको भेज देंगे पल्लवी द टॉपिक वाज इंटरेस्टिंग एंड got to know a lot of information gained knowledgeable about it now thank you so much so Sarin okay Sharon. I think some names don't belong to our culture, so it may be mispronounced. So I'm really very sorry in advance for next coming webinar also. So I would like to pay beautiful thanks to all participants. It was amazing, and the certificate link is going to publish within some seconds. I think it will take. 10 to 20 seconds. I'm trying. Even I'm at home today and it is Sunday, but still we are working. Same like our resource person is there. It is rescheduled session, but a lot of people joined it, and I think this is the point where people are going to be little bit aware about mental health, and schizophrenia is one of them, a disorder where we have discussed about this point. So some few words from our resource person, last few words, if our resource person want to say something.
First of all, thank you for Personality Care Foundation for giving me such an opportunity, for giving me a platform like this. Thank you so much. And thank you for all those who have attended the session. And thank you, my dear students. And I have also seen my cousins commenting. Thank you so much for being there. Thank you so much for all of you for your encouragement and support towards. Thank you so much. And yes, I had to reschedule my session because yesterday I had a unexpected duty that came up. And yesterday evening I was completely mute. I was completely mute because my throat was like I couldn't speak properly. It was paining. I just started my career as a teacher, but in the initial stages itself, my throat is almost done.
Yeah,
So that is the
yeah.
reason why I rescheduled because of my duty as well as the throat problem. So thank you for all of you for joining the session as well. Yeah, thank you.
Yes,
Thank
one
you so much.
more student is there. Thank you, ma'am. Good evening. And this is Samiksha from your class. The session was really well explained and it was interesting. So that's
Thank you,
all
Samiksha.
from our सेशन एंड वेबिनार आप सभी का बहुत बहुत धन्यवाद इसी वीडियो के डिस्क्रिप्शन में आपको सर्टिफिकेट का लिंक हमने डाल दिया है द सर्टिफिकेट लिंक इज पब्लिश्ड so you can just check out and apply from there within 7 days hardly 7 days we will forward it on your same WhatsApp number sometime if WhatsApp number is not there we can email you so thank you so much for this enlightenment session. I would like to pay again thanks to our resource person and वीडियो को आप लोग लाइक करके जाइएगा इसमें काफी मेहनत लगती है और जो नए साथी हैं वो चैनल को सब्सक्राइब कर सकते हैं आपका बहुत बहुत धन्यवाद व्यक्त करते हैं जल्द ही हम मिलेंगे एक और बेहतरीन सेशन में थैंक यू सो मच आपको ये सेशन कैसा लगा जरूर बता के जाइएगा बाद में देखने वाले लोग भी थैंक यू सो मच थैंक्स अ लॉट थैंक यू मैम
You're welcome. Thank you so much to you as well.
श्योर